So what's going on, family? Good morning. Back at this again. You are now rocking out with Eric's Wellness Journey at All Things Wellness 2026. Let's get it. So this part of the story, I will be going into um a woman that lost her eyesight from Georgia. This is not any discouragement on GLP-1 weight loss drugs, aka Ozempic, Mounjaro, Zepbound, wegovy. I'm not telling you this to try to discourage you. I'm telling you this from people account that have suffered things from it. At first, I went on my weight loss journey, and they tried to put me on it, but to tell you the truth, I was a little bit scared, and at the same time, I knew I needed to lose the weight. So where I stood with it was I just gave myself determination and a willpower, and I made it up in my mind that I was gonna do it. And this is why they say, man, the mind is a strong thing. I made up my mind to do a certain thing because I know I needed to do a certain thing, and it basically is coming down to reality of how I move myself and put myself together to actually lose the 85 pounds. You know what I mean? I'm just gonna sit up here and tell you it's not an easy thing. It's hard work. And if your mind is not there and you do not have determination and willpower, that's where it starts first. So, okay, back to the story, guys. I'm sorry. So, Georgia woman part of lawsuit claiming link between GLP-1 weight loss drug and blindness. A Georgia woman said her GLP-1 weight loss drug made her blind. She said she took wegovy to lose a few pounds and ended up losing her eyesight. That's what the doctors was trying to put me on. And kind of funny enough too. I don't know if it's some type of incentive or you get kudo points or get bonuses. But even after the doctor seeing me, my primary care doctor seeing me, and I'm gonna need some likes for this because this is crazy. Please get those likes up. Please get those likes up. Get those likes up. After my doctor seeing me losing all this weight, you know what he wanted to do? Wait for it. He still wanted me to put on the wegovy. Please like, share, subscribe, comment, hit that notification bell. I'm going in. So a Georgia woman said her GLP-1 weight loss drug made her blind. She said she took wegovy to lose a few pounds and ended up losing her eyesight. So she said, my vision is just not what it was, said Diane Worth. She spends a lot of time at her Hartwell, Georgia home these days. It's a lot more difficult, she said. She tries to do her best with chores like cooking with blurry vision. It's just your depth perception is off, said Worth. The former Grady Memorial Hospital nurse, and this is a nurse practitioner, woke up on Saturday just weeks after starting wegovy in February of 2025, so just last year, guys, to lose a few pounds and could not see out of her right eye. So the doctor still wanted to put me on wegovy and still wants me to put me on wegovy. His main thing is preaching that it has great defense against heart attack and strokes and stuff like that. So cardiovascular system. But yet and still, I was skeptical and I was scared to do it. You know what I'm saying? Because I'm the type of person that I'm a strong believer in that if you give your body what it needs and you do the things that you're supposed to be doing, that your body will react and will work for you. And I'm living proof testimony with documentations on what I just told you there. You know what I'm saying? I'm not just saying this, I'm living it. So she couldn't see out her right eye after about a couple of weeks after starting wegovy. She said it was heartbreaking. It was jarring. I was angry, said Worth. I would have been angry too, you know what I'm saying? I would have been very, very angry. She said no one told her about any risk of blindness and it wasn't listed as a side effect. Doctors diagnosed her as legally blind. She can only see blurry shapes through that right eye. Bottom line is there's nothing you can do to prevent Naon if it's going to happen with these drugs because there is not a warning sign. You wake up and you're blind, said Worth. Poor woman. Her attorney, Jason Goldstein, with Parker Walkman LLP, also is the steering committee for more than 130 cases like hers. They're all part of a multi-district lawsuit going before a Philadelphia judge. All of the plaintiffs got NAOM, or non-arctic interior ischemic optic neuropathy, after taking GLP-1 drugs. So it comes on suddenly, you don't feel it, and then it's permanent, said Goldstein. NAOM is essentially an eye stroke caused by restricted blood flow. It's not painful, but it's irreversible. Damn, that's scary, man. It's irreversible. So, man, that's tough. I have a client who is as young as 33 years old who has developed this. I have a client from New York, a 48-year-old gentleman lost it in both of his eyes. So, Novo Nordisk and Lilly are the two big makers of GLP-1, including Wegovy, Ozempic, Mounjaro, and Zepbound. Both companies said patient safety is their top priority. Lilly sent this statement: patient safety is Lilly's top priority. We actively monitor, elevate, and report safety information for all our medications to the FDA as part of our routine safety review process for Mounjaro and Zepbound. We have been ongoing discussions with regulators regarding potential safety topics, and we will continue to review data, including any data regarding ischemic issues. Recent literature has concluded that the evidence does not establish a causal relationship between GLP-1 and RAs and NAOM. If anyone is experiencing side effects when taking a Lilly medicine, they should talk to their doctor or other healthcare professionals. Novo Nordisk said it conducted its own study of 96,000 patients and found no increased risk. Once it happens, it's permanent. There's no going back. So it's scary, said Worth. The lawsuit states that there is a risk, and the companies knew about it from 2004 study published in JAMA Ophthalmology, which found the link between GLP-1s and blindness, yet decided not to list it as a rare side effect. In Europe, the label has been updated for semaglutide, which is what Wegovy and Ozempic is, to warn about the rare conditions in the UK. The same thing, said Goldstein. Novo Nordisk, the maker of Wegovy, sent this statement: the FDA is currently conducting a comprehensive epidemiology study to evaluate the potential safety signal and has not revised the currently approved labels for GLP-1 therapies to include NAOM as a potential side effect. Patient safety is our top priority, and we take all the reports of adverse events related to the use of medicines very seriously. Semaglutide has demonstrated a wide range of benefits within the GLP-1 class beyond glycemic control and weight loss, particularly for people with cardiometabolic disease, considering the totality of events from clinical trials, post-marketing reports, and observation studies. So please like, share, subscribe, comment, hit that notification bell, get those likes up, get those likes up, get those likes up, get those likes up. This is important information on GLP-1 drugs like Ozempic and Wegovy. So this is not to discourage you. It may work for you without any incidents and problems, but I've come to the conclusion that from these people's testimonies and having no vision problems other than having them when they started these GLP-1 drugs, I have come to the conclusion that in most people, the benefits may outweigh the risks, but there are some individuals that go blind from using this drug, and I believe that they fail to list this as even a rare disorder or awareness. So And this is the reason why, and this is why it scared me so much to get on the GLP-1 drugs, even though I know I needed to lose the weight, and just getting older. Health problems were increasing and stuff like that. A lot of the health problems that I had when I was 85 more pounds heavier, a lot of them are gone, and I'm still working on myself. I'm not done yet with getting myself well all the way together, but I've made big decisions, and I came a long way from where I used to be. So that's what drives me, and I'm going to keep going and keep going and keep going. I have my off days, and this is not easy. You just have to get your mind together. Once you get your mind together and you decide that this is what you need, and you start with little steps, it's not about being perfect. It's not about going hard, just, starting off. Just start with little steps and keep going and keep going and going until you start feeling better, until you start seeing results. You know what I mean? And that's basically how I got down, and how I did it, or had the willpower. I'm strongly willpower. When I have to do something, I get it done, So this is what I'm saying and giving you guys warning. Like I said, you may be able to use it without any complications, but just be aware. This is awareness. This is why I call my channel All Things Wellness, Eric's All Things Wellness 2026. So please like, share, subscribe, comment, hit that notification bell. And they also said we will remain committed to patient safety and transparency by maintaining up-to-date safety information and collaborating closely with health authorities and regulatory bodies worldwide. In addition, Novo Nordisk conducted a pool analysis of all randomized placebo-controlled trials in liraglutide to semaglutide, involving more than 96,000 patients, and found no increased risk of NAION associated with either GLP-1 or therapy. Of course, Worth lost a lot when she lost her eyesight. She had to quit her job and lost her independence. She can no longer drive and relies on her husband instead. And now, because my depth perception is so off, when he's driving, I'm always telling him, "You're too close. You're too close." And he's not, said Worth. "So I just smile and keep driving," said her husband. Worth still has her sense of humor, but as a former nurse, she is serious about getting the warning out to patients about the possible link between GLP-1 weight loss drugs and the risk of blindness. So be very careful when you're using these drugs, and be monitored. If I would have read this, that there is a possibility that I could lose my vision, I would never taken this drug. Your eyesight is not anything you can get back, and it's permanent loss, said Worth. So, also, too, I wanted to bring up the fact that the CDC said it may be important to see an ophthalmologist for a baseline and routine follow-up eye exam, in addition to seeing your regular healthcare provider if you're on GLP-1s. The FDA has not responded yet. Of course, they're not going to respond because they already know that this drug does this. So, thank you for tuning in. I just wanted to make you people aware. Like I said, if you really need to get on this drug, just be monitored and be careful. You know what I'm saying? You have to come to a decision on what you want to do and how you want to do it. To be honest with you, this right here scared me, and the fact that when I found out about the blindness, way before I'm giving you this video, I found out about the blindness that these GLP-1 drugs can do, and I said, I'd rather be fat than be blind. Please like, share, subscribe, comment, hit that notification bell. You are now rocking out with Eric's Wellness Journey at All Things Wellness. Listen, take care of yourself.